development with the movement for disability inclusion.
This meeting is being recorded.
And so that is the focus of today's meeting. I'll welcome everyone and introduce the topic of how to use interpretation. I'll give a short introduction of MCLD, and then I will pass it back to Gunjan, who will introduce our speakers today from Kenya, Uganda, and Sierra Leone. At the end, there'll be a short update on where we are in the transformation of our organization. And then if anyone has events coming up they want to share, there will be an opportunity for that. If you are not talking out loud, please mute yourself because we're getting some feedback. So you will see on your screen, or it may be a little globe, or it may be under more, that you can listen to Spanish or French through the interpretation channels. And as you see, we have actually spotlighted our ASL interpreters, so you don't need to do anything about that. You will see them throughout. So we will have breakout groups later in the call. And if you want to be assigned to a Spanish or French breakout group, please add the letters ES or FR to your name. You can right-click on your picture or on the participant list to change how your name is listed. So the movement, for those of you who are new to the movement, was launched in 2015 at the Sustainable Development Summit at the United Nations. We now comprise more than 1,500 local civil society groups, more than 70 international NGOs, and 17 national associations, the newest being in the Central African Republic. Our goals are 5. First is voice and agency for women, youth, and marginalized groups in local decision making. The second is that local communities need a fair share of public resources. At present, in most of our countries, they're not getting a fair share. And we're saying a fair share is at least 20% of the national budget. Third, good local governance, where there are local elections, where local leaders are accountable and transparent in their activities. Fourth is quality public services. So everyone has a fundamental human right to equal access to public services. And finally, resilience. Resilience to shocks. Community leaders are always the first responders to any kind of shocks like climate change, natural disasters, and communities need the resources and information to be ready to respond. Our theory of change is that these national associations form advocacy partnerships to work to change national policies for decentralization and devolution, and facilitation partnerships to be able to accompany more and more communities to become healthy, productive, resilient, and self-reliant. And we believe that only if those two things happen can the Sustainable Development Goals be achieved. We have tools to facilitate communities and civil society groups and local governments to answer the question, how are we doing with community-led development? And we have a website with lots and lots of resources that has translation built in, mcld.org. I highly recommend it. There are hundreds and hundreds of resources there to support us, including, you will see a great picture of Emmanuel there and his story. So with that, I want to turn it over to Gunjan to introduce our speakers.
Thank you so much, John.
Welcome, everyone. Today's topic is something which is super important for all of us at MCLD. Many of you have been a part of our journey as we have been working towards identifying the founding principles, the values that underlie the practice of community-led development. And as those of you who are familiar with the participatory CLD assessment tool know, we always say we start with participation, inclusion, and voice. That's the first dimension of community-led development. Yet in January this year, when we were hosting a meeting with USAID on good practices towards localization, we got an email from Edward. And we realized that, yes, we had been trying to bring in language interpretations and other ways of being inclusive, but even we had actually not been as inclusive as we should be because we had never had ASL interpretation in our meetings. And so thanks to Edward, we now have that. That also made us realize that translating inclusion intent into practice is not easy. And it requires us to constantly keep asking ourselves, are we being inclusive? How are we being inclusive? And what can we do to ensure that this space that we work together in is actually inclusive? That we don't just bring in people with disabilities and people from historically marginalized communities to fit into our traditional modes of thinking, but we actually create a space that builds on their creativity and the different abilities that all of us build in. And that is what today's call is about. We are also hoping with this call and the work that we will continue to do through the year, as John said, this is not a one-time thing, to really bring together two extremely strong communities and movements, the disability rights movement that is really giving us the slogan that all of us have been using in community-led development and locally led development of nothing about us without us. It comes from the disability rights. And of course, the current localization movement. So we really hope that the two will come together as we move on this journey. And with that, I want to introduce a little bit about how today's section and call will work, and to introduce our speakers after that. So this section of the call is actually going to be in three parts. First, we're going to have three wonderful conversation starters, three wonderful practitioners who will share with us how do we translate the inclusion intent into practice at the community level in the work that we do, at organizational level, and also at the level of networks like MCLD. Then we are actually going to do a commitment mural. So it's not enough to just think about and say we will be inclusive. What is it that each of us is actually going to do to become inclusive and to ensure people with disabilities are part of the work that we do? So we're going to get into a commitment mural. And then we're going to go into breakout groups to examine everything that's come up in the mural. And in small groups, look at some of the challenges that may come up for us and how we are going to address them. And very concrete steps that we will take organizationally and at the movement to ensure inclusion of people with different abilities. For the next, for the time that we have today. And so let's introduce our three wonderful conversation starters and speakers for today. Anne Praxyeta Gidudu from the Support Agency for Intellectual Disabilities in Uganda. We have with us Evelyne Amunga, who is from the Young Women Economic Empowerment Program, Kenya. And we have with us Hadiatou Diallo from One Family People, Sierra Leone. So welcome, Anne, Evelyne, and Hadiatou. And we really look forward to your starting this conversation for us. So I'm going to invite Anne first. Anne, could you please unmute?
Yes, I have.
Great. Over to you, Anne.
Hi, everyone. Hi everyone.
Hi.
My name is
Hi.
Anne Gidudu, co-founder for Support Agency for Intellectual Disabilities. I know I have limited time, so I'll just dive into it. I'm looking at disability inclusion and community-led development and CLD through the eyes of the Support Agency for Intellectual Disabilities, SAID. About SAID, SAID was founded in 2017. We took to the floor at about 2019. And the vision we have is a future where people with intellectual disabilities and development disabilities and their families are appreciated and recognized in society. And our mission is to influence societal mindset in full inclusion of people with intellectual and development disabilities. And our values are very simple. Preservation, potential, participation for all. And then there's respect and equality, unity in diversity. Then we have to be accountable and transparent to our things that we do. And then there's equity and solidarity are few of our core values. To that effect. And next, please. Just a simple snapshot for playtime for some of our children with intellectual disabilities. On the left, 2 boys playing with the ball. And then that shows you that children with disabilities also love to play. And looking at sharing of experiences by families of children with disabilities, that's a group of parents with their children. We like coming together, so we're able to share and support each other through the movement. Next, please. And we have a simple approach. As you look at it, the what in blue symbolizes people with disabilities, and pink symbolizes the families. So the families, the people with disabilities belong to families. And yet again, the people with disabilities belong to the communities. So the communities are embedded with the families and the people with disabilities. So working with the communities is essential in making lives for people with disabilities better. And as programs are simple, livelihoods that people have better lives, education for all, health, and we promote a lot of independent living because at the same time, people with disabilities will need to have the belief that they can be able to do something. So promoting independent living is really key for us. And then embedded with nutrition and wash practices, because this is something that much as someone has disabilities, they need to be able to eat right, they need to be able to have access to water, good sanitation places, that they can be able to be part of a community that they can be able to enjoy. Next slide, please. Yeah, now looking at disability inclusion in community development, all people, regardless of their abilities, should be able to participate and engage in a full range of community activities without barriers to achieve their goals while living meaningful lives. And what we do is, starting from our structures, from the committees to at the grassroots, right to the board level, all include people with disabilities, so that they're able to have visibility. It is very key for us. And it doesn't matter what people, society says, or what can they really be able to have or present for us at any of these committees, but having them be part of it is visibility enough for them to know that they exist. And we also do a lot of creating awareness on rights. People with disabilities are involved at all levels, which creates visibility and inclusion. And also sharing of experiences gives hope and allows knowledge exchange for families of people with disabilities. Then we also have joint advocacy conducted by SAID and families of those with disabilities. It has been able to yield committees for people with disabilities in one of the divisions in Kampala, where we have been able to acquire an office space from the local leadership. That shows the community, the CLD. Then the division of Nakawa responded to a request to contribute to livelihood programming for people with disabilities through the special grant under the Ministry of Gender, Labour and Social Development. And some parents, the self-help groups, have attended trainings in art and crafts and tailoring with the support of well-wishers in the communities. because this shows still the aspect of community-led development. Now, as 6 parents self-help groups, which brings a total of about 66, have benefited from a savings and loan scheme. And we were fortunate to receive some donations from the Turkish embassy with assistive devices for children with disabilities, which included walking aids and wheelchairs, and also adaptive technology. You know, WhatsApp has been something that has really been helpful for us, because you're able to share the messages on these social media forums, they're able to share with those who don't have it. So it has been something that has been able to work for us in information sharing. Next, please. Next slide, please.
The challenge?
This doesn't go without challenges. We always have stigma because of someone having a disability. It goes. Hello, yes, please. Yeah.
Yes, if you're not speaking, please mute. There was some voice in the background, but go ahead, Anne.
Yeah, we have, with having a disability doesn't go without challenges. There's stigma when people have disabilities, then they are always discriminated when it comes to any engagements in the communities. Then we have a challenge of inadequate funding for some of our activities. There's a lot of bullying that goes on in the communities of having someone, especially in schools where children with disabilities are attending. And there's a technology barrier. The phones today are not user-friendly for someone with disabilities because of the different applications that need to be used. And then we also have accessibility, especially in the slum areas. Sanitation is really a big deal. Water access, the road networks, the structures alone still are a challenge. And I think that's what I can share for Said in summary. Thank you very much.
Thank you so much, Anne, for taking us through, how you work with communities to ensure inclusion, and what, highlighting some of the challenges that come up in the process. We will, as we go through the call, look more deeply at some of these challenges and ways for us to address them. But thank you for getting us started with that. Before I invite our next speaker, I do want to again say that please, if you would like to be in the French breakout group, put FR in front of your name. If you would like to be in the Spanish breakout room, please put ES in front of your name. And if you would like to be in a room with ASL interpretation, please put ASL in front of your name. You can do so by clicking on the participant list and right-clicking on your name, select rename. Please do that because it's very important that everybody is in a breakout room in a language that they are most comfortable in. Okay, with that, we are now going to move to Kenya, and I'm going to invite Evelyne, our speaker from Kenya, to tell us a little bit about, what inclusion for people with disability looks like. And especially, I know you were going to speak to us a little bit from the gender perspective also about what it looks like for women with disabilities. So over to you. Evelyne, we can't hear you. Sorry, Evelyne, we are unable to hear you. Evelyne, would you like to log back out and log back in? I think there is a connectivity issue. Apologies. In the meantime, I am going to move to Hadi to tell us a little bit about what it means really to look at inclusion for people with disabilities, for INGOs, for networks and local organizations. What can we do to take us a little bit through that journey? that you have had at One Family Love. Hadi, can I invite you to unmute while we sort out the technical challenges with Evelyne? Hadi, are you able to unmute?
It's me?
Yes, great.
Okay. Just a minute. I'm gonna remove the video because I have a co-facilitator with me here, you know.
Don't worry, that's perfectly fine.
Yeah. Honorable guests, good morning, good afternoon, and good evening, wherever you find yourself in the world. Permit me to stand on existing protocol. I am extremely honored to join you on this call to share some of the important lessons of accessibility, inclusion, and participation we learned over the years, and how to intentionally include people with disabilities in light of our in-depth social work with communities of people with disabilities over the years. Many thanks to the global movement for community-led development for bringing us together. Let me, however, start by saying that disability is part of being human. And disability is a human right, and human right is disability right. Almost everyone will temporarily or permanently experience disability at some point in their life. An estimated 1.3 billion people, about 16% of the global population, currently experience significant disability. And this number is increasing due in part to population aging and an increase in the prevalence of non-communicable diseases, according to World Health Organization. Disability is more prevalent in the global south, where people with disabilities are more likely to have less education, poor health outcome, lower level of employment, and higher poverty rate. Worldwide, people with disabilities are often excluded from leadership roles or even fully participating in the political and economic life. They face a multiple barrier, including social stigma, discriminatory laws, frameworks, policies, lack of infrastructure, and inadequate measures to accommodate their needs. And as One Family, people would believe that persons with disabilities are powerful, radiant agents of change, and they are devoted to changing things for the better. They know more than everyone what needs to be done and how it can be done. And let me also tell you that persons with disability have the right to participate fully and effectively in decisions that affect their lives, and their participation is essential to removing the barriers that prevent their full inclusion and participation in society. We acknowledge that reaching the goal of the Leave No One Behind requires the active involvement of people with disabilities at all stages, from planning and designing to implementation, monitoring, and evaluation. And One Family People is committed to working with CLD in developing strategies that aims to achieving equality and inclusion of persons with disabilities, and making sure that inclusion is a culture in CLD programs and partnership. This need to start with the collection of data, disaggregated data by disability, gender, age, and also increasing consultation and participation of persons with disabilities in your networks, and ensuring that persons with disability play a full part in society is key to achieving the Sustainable Development Agenda. And 15 years ago, I joined Edward to establish a non-profit human rights organization called One Family People, which aims to break barriers for persons with disabilities in Sierra Leone and beyond. And for us, in order to create an inclusive society where every person with a disability, from children to adults, men and women, enjoy equal rights and thrive, we needed to live in solidarity with over 150 homeless people with disabilities in the streets at the heart of Freetown, Walpole Street. Together, we lived in a dilapidated building. For nearly 2 years, the building was abandoned during the war, which has no door, no window, no light of water, no food every day. We were sleeping on boxes to keep our body warm. We decided to create the Great Wapolians as a music and drama group performing live, because we wanted to to showcase the abilities and the powers persons with disabilities have and the contributions that they have to put in nation development. So we began to compose advocacy materials. It became clear right away that the time was right to bring back classic sounds, raise awareness of disability as a human rights issue, as I stated earlier, and showcase the talent of people with disabilities in Sierra Leone. And we decided to engage government as a strategic partner. At that time when we started, disability was seen as a cause, as a witchcraft, and as people that depend, they have no value, they have no contribution, and they are troublemakers. So this is why this group was created, to change that perception and create a bridge between the two. So during this period, we learn about the strength of collective solidarity, leadership, and self-organization at the least probable place, Walpole Street, with people with disabilities. We still rely on what we learn from them to teach young people with disabilities, particularly girls, how strong they are and how strong we can be together. And for you to intentionally include people with disabilities at community level, at institutional level, at organizational level, first of all is the planning. But often people put, whenever we in our advocacy, we engage stakeholders, they tell us, yes, we have people with disabilities in mind, you know, we really value them, but during implementation, we see that they are excluded. So now we change the strategy. So our advocacy started focusing on remove the persons with disabilities in your mind and put them on the paper. Because if you have them on the paper, then you will remember them in the implementation, so they will benefit from the outcome of your intervention. So including them in the planning is key to intentionally include people with disabilities in your interventions. And then communication is another key. So you need to communicate from the top that all people, including people with disabilities, have value and are respected and openly welcome in your organization. It should be part of your organizational DNA. Your board, your CEOs, your senior leadership and staff need to be explicit about the importance of fully including people with disabilities. Your website and all other materials should clearly communicate that disability inclusion is part of your organization's vision, mission, and values. And it should be an intentional consideration at every stage, not assuming or taking as afterthought, you know, or putting them in your mind. You also need to acknowledge, understand, and embrace the diversity nature of disability. because disability touches every demographic categories, gender, age, race, sexual orientation, etc., and affect most people eventually through accident, illness, or aging, as I stated earlier. So the population of people with disabilities varied with different type and level of disabilities. Some people have disability from birth, while others acquire them due to accident, aging, injury, or illnesses. Certain disabilities are visible because they require use of wheelchair or other assistive device, while others are invisible. You know, those with learning or attention or mental health or are invisible. Many people with disabilities, with invisible disability, are still in the closet due to stigma. You may be surprised that one of your top management or one of your staff is having a hidden disability and they are hiding it, they are struggling with because they are afraid of stigma. So you need to support them. You need to encourage, once you have this kind of statement in your organization, this will motivate and give confidence to people with disabilities, and then for them to feel welcome in your organization.
Thank you.
Yeah. So you also need to recognize the talent of people with disabilities. You need to understand that they are talented, and you don't need to look at them as people that do not have competence. They do have competence. You need to accept them, you need to appreciate them, and you need to create a platform for them to participate. This is what we do in our implementation. Persons with disability are at the front and center in everything we do at One Family People.
Thank you so much, Heidi. That was super helpful, and you gave us a lot of very concrete suggestions also of how we as organizations can, ensure inclusion, not just in the work that we do at the community level, but also within our organizations themselves, which I think is super important. Much appreciated. I know we have Evelyne back. Can we try and see if we can hear from you, Evelyne? And I know we have had a couple of hands raised as well as some really interesting conversation in chat. Please continue to use the chat to share your comments, your feedback. We will delve deeper into some of your comments soon. But for now, can I hand it over to Evelyne?
Hello.
Hi, Evelyne.
How are you?
Very well, thank you. And we can hear you now. Perfect.
Okay. Thank you so much. My name is Evelyne Amunga from Kenya. Presenting the agreement program is a community-based organization was initiated in 2014.
Apologies, Evelyne, but your connection is, your sound is not very clear. Can you try maybe moving a little closer or farther away from your mic to see if that is an issue?
Hello.
Hi, Evelyne. We are not able to hear you. Evelyne, we are not able to hear you. I suggest we are going to come back, Evelyne, and see what we can do to tackle the technical challenge. We definitely need to hear from you. Do you want to try logging in again?
Or perhaps from her phone. That might work better than the computer.
Yeah, maybe you want to try logging into your phone, Evelyne. And to everybody else, thank you so much for your patience. Our commitment is to ensure that we hear from community-based organizations all over the world. And that does mean that there are connectivity challenges, as all of you know. It's not easy to get online, but that's no reason why we should not hear from the valuable experience coming from different places. So we will keep trying to ensure that we hear from Evelyne. Evelyne, do you want to try logging in through a phone?
And maybe Steve can reach out to her and help
Yes.
her.
And while we figure that out, I wanted to quickly, maybe what we can do is that we can start with the commitment mural. And as soon as Evelyne is back, we will try again to hear from her. So what is the commitment mural and why are we doing it today? None of us, I think, who are here today, or even people who are not here today, can say at this point or at any point that we don't want to be inclusive, or people with disabilities should not be a part of the work that we do, or should not be, channelizing their creativity to tackle the very difficult, challenging issues that we face every day. The question always is, how do we translate this intention into practice? And as we recognized and realized at MCLD, that really requires a stated commitment and identification of actions. These are the three concrete things we would do. I know our commitment to Edward when he first brought it up in January, the part about inclusion, was that we will ensure going forward to include ASL translation into our events and to look at and write ASL translations as well as other aspects like Braille translations into our proposals and into the work we do. That was our commitment. This call was our commitment as another commitment to doing, to taking a step in this direction. So what we want to do through the commitment mural is to identify very concrete steps that we as individuals, our organizations, or we as MCLD or the networks we are a part of can take so that this isn't just lip service to the idea of inclusion, that it's not just a good intention that stays in our heads, but it's something that is reflected in our everyday work. And so for those of you who are not familiar with murals, what's going to happen is that we will share a link. You can all click on it, select any chit. There'll be a number of colored chits. Select any chit and type in the language that you are most comfortable in. We have English, French, and Spanish speakers here today, but also if there's some other language, that's okay. Type in the language that you are most comfortable in, your own or your organization's commitment to including people with different abilities and ensuring that their agency is recognized and supported. I will put in the mural link shortly and we'll give everybody a few minutes to do that. If you're not able to navigate to the mural, then don't worry. You can put your commitment in the chat box and we will put it in the mural. It is optional, but I highly encourage you to put your name or your organization's name in the mural when you make your commitment. And as I shared that, I want to again see if we can have Evelyne speak to us. Should we try once more? Evelyne?
No, she has not been able to connect her audio.
Oh, okay. So she's going to try and record a piece for us so that we can play that. Okay, so let's start with the mural. And I see a hand up, Villobo. And I know that Vatican had their hand up as well. So let's start with Vatican actually, because you've been having your hand up for quite some time, and come back to Villobo. And in the meantime, we will put the mural link into the chat box. Vatican, do you want to speak? Humana? Please feel free to share what you want to say. Okay, Valobo, do you want to unmute? And then Kasim will come to you after Valobo.
Yes, thank you so much, MCDL and the team that write on this call. I am so grateful that this year we are talking disability or inclusive, including disability, persons with disabilities in our programming. These are a set of people who are really most times sidelined by many programmings that comes to the community, and hence has made many of them to remain people who are watching with a lot of pain. And as Youth Development Organization Uganda, where I serve as the head of office, we have always been looking at how do we mobilize resources to ensure that communities look at these people as equal as they are. Because programmings that involve persons with disability requires a lot of resources. Yes, like the previous presenter had said, we need a lot of mindset in the communities, and yes, that is on the side of the community, but we need to, as we look forward to social inclusion in our programming for the persons with disabilities, we need to look at how best can we then empower this group of people so that they cannot just only start living socially right in the community, but economically also empowered, so that as we empower them, the community starts seeing that they are able to meet their daily needs as a family or as a people in the community. I've seen a number of children to persons with disability miss schools, or could not have, their parents could not afford to pay them in school, and many of them would end up staying home or lounging around in the communities, and seems like nobody bothered even about their well-being and so on. And so I think as we begin this here in style, we need more resources to be mobilized towards empowering communities with, or the community of persons with disability. As we already have a program which we look at how best we can work with these people, although we are yet at the initial stage because we don't have enough resources. We don't really have a good table.
Apologies for interrupting, Valobo. We definitely need to have this conversation and sharing, but this is exactly what we intend to do in the breakout rooms so that everybody has a chance to speak. We are about 102 people on the call, so we want to make sure that we have time to hear from everybody in the breakout groups. So I'm really sorry for cutting you off, but can you please in 30 seconds wind up your comments so that we can actually move to breakout groups? And before that, I know Kasim and Edward, who are our ASL interpreters today, have their hand up, and I really want to ensure that we hear from them. So Valobo, if you can please wind up your comment in 30 seconds, we'll hear from Kasim and then move to breakout.
Right, thank you. In conclusion, I would appreciate, like you said, we need more community sensitizations around persons with disabilities and how we can draw programs that are inclusive to them. Thank you so much.
Thank you, Valobo. Edward or Kasim, whoever is speaking, if you want to unmute and speak.
Okay, if you see on my face cap, thank you very much, everybody. Good to be part of the platform again. You see my face cap is written, leave no one behind. You say leave no one behind. You say, you know about disability, leave no one behind. So you know about CLD, you must not leave no one behind. Leave no one. It's time for inclusion. The MDGs, I mean, didn't specify about disability, but SDG talks about disability. we have an opportunity on 17 goals to collaborate together to see how we can be able to make sure we foster a society that is fit for all. And what we're doing today is about the ASL, but it's more to that also, by making sure that most organizations, also even schools, also make sure there's a sign interpreter to make sure when those kids pass out from primary school, they go to secondary school, there can be a sign interpreter to get them through secondary school and university, like how we're doing in Sierra Leone, whereby we're training secondary school teachers to receive children from the deaf schools. So also we have the autistic kids also, you know what I mean? There's no space for them at schools. So making sure programs and education becomes something accessible to everybody is what we are really pleading about on this platform. People think working with persons with disability or children with disability is really expensive. But if we plan for them from the beginning, it becomes much more easier to understand that they have a lot to contribute. They're so talented. Some of them, without even going to school, they know how to repair radios, TV, phones. There's so much to learn from our family with special needs. So for me, it goes a long way, you understand that this platform is a blessed platform, and I really want to encourage you, Gujan, and everybody to put disability first. It comes at an early age or at an old age. It's what we cannot run away from. So for me, leave no one behind is what all this is all about, and which we are there to support you about. Thank you very much, everybody. God bless you all. Thank
you, Edward. So what we want to do now really is that we're going to continue to try and see how we can hear from Evelyne. She is recording a video for us, a message for us, because her connection did not allow her to have good audio. I see a lot of people are filling out the commitment mural. Please continue to do so. What we're going to do now is we are going to move into breakout rooms. We've heard from, Anne, we've heard from Haiti, we've heard from some of our other colleagues who shared here. We've had some rich conversations in chat, and they raised some really important questions. In our experience, what have been some of these good practices that we've been able to implement at the community level, at the organizational level, to ensure that people with disabilities are included, and are included equitably as equal partners in our work, right? What are some of the challenges that we encounter? What is it that we can learn from each other? What is it that we can do together? And what is it that we at MCLD can do alongside you to ensure this inclusion? These are some of the things that we are going to be discussing in the breakout room today. Please take a look at the mural. Everybody will have the mural. So please take a look at the mural. Look at the ideas that others are putting up. Think about which of these can we try. Think about which of these have we already tried. Did we come across some difficulty in implementing them? If so, what kind of challenges did we have? And think about what can we do to overcome these challenges? Because at the end of the day, inclusion is most important. And we have to include people with disabilities or different abilities equitably in the work that we do. The breakout groups are going to be for 25 minutes. Please have somebody take notes in your breakout group. If you want to be in the French and Spanish groups and you have not been put into the group that you wanted to be in, please come back into the main room. My colleague Sarah will help you get to the breakout room that you need to be in. Feel free to put into the mural in French or Spanish if you need to, or any other language. And with that, Sarah, are we ready to have people go into breakout groups? Please have somebody capture your discussion, appoint a note taker. Please have your note taker copy paste whatever discussion you have into the chat box when you come back. And have somebody who will be willing to share some of the ideas with us in the main room when you are back. I will stop sharing my screen. And Sarah, are we ready with the breakout group? We are. So 25 minutes, let's talk about concrete actions and challenges.
Hi, everyone. If you need help getting to your breakout room, please let me know. If you're in the wrong language, please let me know that as well, and I'm here to help you. Hi, Simon and Gabriel. Can I help you to reach a breakout room? Did you receive an invitation to join a room?
This meeting is being recorded.
Hi, Sarah. We wound up with a lot of Francophones in our group and were unable to capture their ideas. So, Sarah, perhaps you could ask any Francophones who are in the wrong group to put their ideas in the chat.
Hello, John.
Hello.
Yes, this is Francis from Uganda.
Wonderful to see you, Francis.
Yes. Are we set to make presentations?
No, we're bringing everyone back, and then Gunjan will call on people to share from their breakout groups.
Right.
Yes, and as we do that, I also want to make sure we take a couple of minutes, John. I have shared on WhatsApp a video that Evelyne has recorded for us because she was not able to speak directly. If we can play it for everybody to ensure that her voice is heard,
Yes.
that would be fantastic. So while
Can you
get,
do that?
I have forwarded to you on WhatsApp because I don't know how to play it from WhatsApp.
Okay.
While
Okay.
you figure that out,
I will do that.
thank you. So while John is figuring out how we hear from Evelyne about her ideas and what she wanted to share with us, welcome back, everyone. For those of you who have already posted into the chat, thank you. Groups that have not, if you could please post your discussion and ideas into the chat, that would be fantastic. The Spanish group can post in Spanish. The French group can post in French. That's perfect. And for others, if you were not able to type it, if you would like to just speak and share your ideas, that is also fabulous. And while
our group will be doing that.
Yeah, 1 second, just 1 second. And while we hear from you, I am also going to get the mural back up because I'm going to encourage you all to go back to the mural and put in other ideas that you have heard, commitments that you can actually talk about. And then if the groups want to share back what they heard. So group 1, anybody from group 1 wants to share what was discussed?
I don't know whether we belong to group 1. Are we group 1?
That's okay. Whatever you group you're in, that's fine. Just go ahead. It doesn't matter.
So I had the problem with my gadget, and now this is Seth talking and not Samuel. So I was the one taking notes for our group.
Yes.
Now,
we were group 1.
Yeah, some of the actions that we identified are forming technical working group within our local areas to help in channeling information and also to help in incorporating these persons with disabilities so that they can share with us, they can be on the table when everything is happening, and they are not only called when everything has been planned. The other one, there are barriers that persons with disabilities and they don't get information. I think it also gets in my first point. And the second point is organizational policies. We were thinking that some of the organizations, they don't have policies that actually incorporate persons with disabilities. So we really need to look at some of our policies, and we must ensure that these policies also promote inclusions of persons with disabilities. The other one is advocacy and accountability. Advocacy, we really need to work, we really need to do a lot of advocacy. And somebody identified that even some of the halls or meeting places, they are not accessible to persons with disabilities. So we really need to do advocacy so that we create awareness. Even when structures are being designed, they really need to know, is this structure we are putting up, is it friendly to persons with disability? Can they access it? And even most of these meetings, you find that there are no sign language interpreters. So you find that we only talk, but some of our persons with disabilities miss out. Another thing is aspect of technology. You find that most persons with disabilities, they miss out on technology that is currently sweeping the whole world. Even we were asking ourselves, even this meeting that we are now attending, you find that we don't have persons with disabilities. And if we have, then their number as compared to persons without disabilities, you'll find that their number is low, meaning that they are really missing out. And this is where we said that where there is a gap, it means from the earliest stage, we really need to do screening, and after doing the screening, then we shall have identified if the person or this child is born with disability. And if the child is born with disability, are we able to follow this thing from the earliest stage so that when the child comes of age, then he has the education, he can be taken through technology that is now sweeping the old one. And in that way, we think that they will not miss out on some of the things that people are, or the world is currently embracing. Another one.
Seth, would you mind also putting some of this in the chat so that we have a record of it? And I'm also very cognizant of time. So we'll go back to the other groups, but I think we have the recording ready. Can we play that and just hear?
You have to stop. You have to stop sharing first, Gunjan.
Yes, I will stop sharing.
And then I will share.
Thank you. I'm going to put it in the chat box.
Thank you so much. Much appreciated.
Thank you. Welcome.
May I present for our group?
I'm sorry for the inconvenience. My name is Evelyne Amunga. I'm from Kenya, representing Young Women Empowerment Program. Young Women Empowerment Program is a community-based organization that was formed and is led by women with disabilities. And we formed this group in 2014 with the intention of building the capacity of women with compounding vulnerabilities so that they can be able to take control of their own lives. Previously, our activities have been to build the capacity of these women with disabilities to take action in political, economic, and social activities in their communities. Previously, we have been active ensuring that women with disabilities are not left behind in leadership and in political spaces. This means that we have been able to build the capacity of these women through civic education to empower them so that they can take lead or they can take part in governance, to elect their leaders, to participate in elections, and also to vie as representative of their areas. We have also been able to champion for sexual and reproductive health and rights of women with disabilities, bearing in mind that most people with disabilities are usually left behind when it comes to healthcare. As my other speakers alluded, we find that most people with disabilities, they're excluded because of certain barriers ranging from accessibility. We find that some healthcare providers, they have negative attitude and perception regarding to people with disabilities, and these are part of the attitudinal barriers. We have the economic barriers and the other barriers. So we have been trying to, through your web, to build the capacity of women with disabilities to demand their rights, to demand for their sexual and reproductive health rights, to know what to do in case they are defiled or they are raped or they undergo any other gender-based violence. We also campaign against drug and alcohol abuse because we find that most people with disabilities are used by the kingpins to sell drugs, to participate in drug abuses, and other challenges that affect people with disabilities. They might draw them back to the margin so that they can also start consuming these illicit brews. So we campaign against drug and drug.
Thank you for playing that. Thank you, Evelyne, for trying to get this across to us. I know we've had technical challenges, and thank you everyone for your patience. I think for us earlier this year, last year, one of the things we realized was we had a choice between having perfect calls and events and between having inclusive calls and events. And we chose inclusion, and we hope all of you will join us in this choice. So we have a couple of minutes left. If any group wants to really share something that they heard, or anyone wants to really share something that they heard, that they feel is something they can apply immediately, that was new for them, please do so very briefly in a minute, unmute or raise your hand, and then we will go into the section around next steps and announcements.
I'm here interested in putting across our group discussion.
Yes, please.
Yes. I don't know the group number though.
That's okay. Don't worry.
Yes.
Please go ahead.
But among the things we shared is about having night husbands or wives. The men go for sex. The men or women go for sex only in the night. Without the consent of a disabled person. We felt it was something which is a challenge. The myth on disability as well is not well known. Another thing is we discussed this, the structures to support the rights of the disabled is not well streamlined. And also the knowledge of the rights of disabled person is also not very clear. In fact, we went as far as bringing in the component of treaties that should be made by the African countries on disability, so that protocol on human rights perspective is signed by the countries and is implemented. Bringing in the disabled to participate in the implementation of activities is one key component. And as well, we need to do research so that the disabled are known. Which type of disability are we talking about? How many are they? Where are they located? Is it in the urban center only or even in the rural setup? A research work would make it easy for us to know about that one and then have a real data on disability. Engaging the community in a wide perspective, sensitizing them so that people know more about the disabled. We need to also now give them leadership roles in order to make things easy in all perspective. For our organization, for your organization, and as the individuals who take up the leadership role when they are also disabled, it's very important. It is part of the items we discussed. I did not exhaust all, but I think part of it has appeared in other people's presentation. So that is partially what we could. Thank you so much.
Thank you so much. I see two more hands up. We are at time also. We'll suggest the following in the spirit of MCLD conversations and meetings. We will leave the call open for those of you who can stay so that we can hear from people who still would like to share and have their hands up. But in the meantime, for those of you who need to drop off, I completely understand. We know everybody's got very busy days. Joining us if you are leaving us now. We will be sharing the mural board link as well as the recording of the song that Edward and One Family Love have shared on Leave No One Behind with everybody who has been on the call. We really encourage you to continue to think about what can you do in your own organization and what can we do at MCLD to ensure inclusion of persons with disabilities. Hold us accountable. If you think we are not doing enough for access, even at our global meetings or at the national association levels, bring this up and hold each other accountable. That is the only way we can ensure that no one is left behind. We have a few announcements that we will be coming to, including the date you can see here very quickly that we are piloting the community version of the participatory CLD assessment tool. And if you're interested in that, please write to us if you want to pilot it. We expect to release the tool in May. This is the same participatory CLD assessment tool that many of you are familiar with and have been using, only it's the simplified version that we can use at the community level. This week, we also have a training on the participatory CLD assessment tool coming up. We continue to co-create the future of MCLD that John alluded to earlier. So sign up for the listening cafes if you haven't. These are just spaces for you to come in and we listen. We just listen to what you think MCLD should do, your vision for it, your structures around it, all of that. So it's essentially your space. Sign up for them. The list is available on the website. And finally, to our January call with USAID on good practices for CLD, which was only for community-based and local organizations, we have now compiled the results. We had 190 people on that call. We had 172 survey responses. We will be compiling all of that. We've done that with Peace Direct and submitting it to USAID to reflect what community-based and local organizations think about community-led development and locally led development and how USAID should go about it. So that was a very quick look at some of our upcoming announcements for those of you who need to drop off. And Michelle, I've done Michelle, over to you. If you're speaking in French, don't worry, I will request somebody to translate for us. Michelle Lunda.
Ok, merci beaucoup. En fait, je voulais juste donner une synthèse de ce qu'on a fait dans notre groupe par rapport aux défis et par rapport aux stratégies qu'il fallait prendre. Alors, par rapport aux défis, nous nous sommes dit que les grands défis, c'est la considération que les gens ont de ces personnes vivant avec handicap. Il y a la discrimination et il y a la sous-estimation. Deuxième défi, il y a le complexe d'infériorité. C'est les personnes vivant avec handicap se sous-estiment. Ils ne s'acceptent pas, ils se sentent incapables. Et ça fait que c'est un défi. Aussi, un autre défi, c'est leur habileté, c'est leur mobilité, et qui ne leur permet pas de participer au même niveau que les autres. Ainsi, nous avons aussi la perception des membres de la communauté par rapport à leur handicap. Et enfin, par rapport au défi, c'est le fait que le système lui-même n'est pas adapté à tout le monde. C'est que les gens, les personnes vivant avec handicap trouvent un système qui n'est pas adapté à eux. C'est qu'ils se retrouvent sans soutien et sans support. Et par rapport à tous ces défis-là, nous avons élaboré quelques stratégies. La première stratégie, c'est les approcher et s'intéresser à eux de manière intentionnelle. C'est-à-dire, nous devons planifier comment nous devons les approcher et faire une bonne considération. Nous devons les conscientiser sur leur statut et aussi, nous devons sensibiliser les autres membres des communautés pour qu'ils arrivent à accepter les personnes vivant avec handicap. Nous devons les intégrer dans un système pour pas le faire seulement verbalement. Nous devons nous-mêmes le mettre en pratique, c'est-à-dire pour les aider à ce qu'ils acceptent leur situation. Nous avons trouvé aussi qu'il fallait créer des mécanismes à prendre en compte depuis les communautés jusqu'au sommet de l'État. C'est-à-dire, ça ne doit pas seulement rester au niveau des communautés, mais nous devons faire des plaidoyers pour amener ça même au niveau du sommet de l'État afin que ça soit pris en compte dans les constitutions et dans les autres instances au niveau des groupes. Et enfin, nous devons aussi leur donner la parole. Et pour que les gens puissent écouter, il faut leur donner la parole afin que tout le monde puisse les considérer, et les gouvernants et les autres membres des différentes communautés. En fait, c'est de manière brève ce que nous avons dit, et nous-mêmes, en tant qu'agents de développement, nous devons garder notre constance par rapport à tout ce que nous rencontrons comme obstacle pour aider ces personnes vivant avec handicap. Nous devons rester constants et continuer à les aider à marcher pour leur participation. Je pense que de manière synthétique, c'est de ce qu'on a parlé dans notre groupe.
Thank you, Abdul and Michelle. This is going to be slightly impromptu, but I'm going to request if Sarah or any other bilingual speaker will be able to just summarize some of the main points for us. Sarah, are you able to help?
Yes, 100% I can help. I will do my best to summarize what the French group talked about. There's a lot to say, but they discussed the consideration that people live with discrimination and underestimation, and that people living with disabilities might feel unable to cope, and that their mobility may not allow them to participate. And in the end, it's the fact that the system is not adapted to them, and they often find themselves without support. And so the French group talked about some strategies, including to approach people who are differently abled and to interest them in an intentional way, to sensitize other members of the community, to help integrate people with different abilities, and to create mechanisms, because this effort can't stay at the community level. It has to be taken to a higher level. And finally, to give differently abled people the microphone so that everybody can hear their voice.
Thank you so much, Sarah. Much appreciated. And thank you for doing it on the spot. I see Edward, Kasim and Edward, you have your hand up. I will give you the mic for, if you can just be brief, because we are well over time, and then we will wind up.
Okay, thank you very much. In our group, I think it was group 5, what we talked about mostly was what we were doing to address issues of persons with disability, but most of all, it was really about the challenges. And there's what we call the community-based rehabilitation, the CBR component, which most organizations are now working on. Our partners in Netherlands, Leone Foundation, that supports us, support about 5 organizations in Sierra Leone, sending 800 kids to schools with special needs. It's been incredible what the CBR has been able to do in the communities, in making sure the district council chairman, the local chiefs, the service delivery. We know we do a mapping of service delivery to make sure that this service are delivered to these kids and other sorts in the community. But most of all, also, it's also about helping to lobby stakeholders, because most of the time when we support persons with special needs, they finish from school and they graduate, we don't follow up with them to even get a job. Lobbying with government to make sure at least, when companies, they are having their new companies, they can have 10% or 5% of their population staffs to be reserved for persons with special needs. That's very, very important. That can help for employment of persons with special needs. Some, when they finish, they find it very, very hard. These policies really work a lot. One of the things in Sierra Leone, the National Disability has done with us also, National Commission for Disability have done, is to make sure that if you are an employer, you employ somebody with special needs, they'll give you tax discount. It encourages people to employ persons with special needs. And that means that we are reducing people from the street And when we talk about the same discrimination also, the CBR component talks about sensitization in different schools, in different communities that help to sensitize people and let them know that involving persons with special needs is about making sure we leave no one behind, but it has to be in practical. Making sure that we tailor all our needs to meet their needs is very important. I mean, to meet their wants is very, very important. So it's not something very expensive to work with persons with special needs. If we come together, I mean, the INGOs, the NGOs, to lobby both private sectors and public sectors to include persons with disability in their program. The ministries of social welfare, all the line ministries, they should cut across. There should be a disability desk. Make sure that when they are planning, they can remember to plan for persons with special needs. It's not when they finish planning, they call them to come validate the documents. When it's time for research, also they should be included in those research. So for me, the CBR component is what I think most organizations should really look at. I mean, the component really helps a lot to define how we should include persons with disability and how the entire community can come. Because in Sierra Leone, we say it takes an entire community to raise a child, not just the family member. So the CBR component has really worked for us in Sierra Leone, and we can share with you the report also if you want it. I mean, we work with the University of Rabat in Netherlands, so also, I mean, and the other university in England also, whereby they were able to come and do research, and they could see it worked a lot. So that's one step. We learn every day, and we have to move forward every day. Thank you very much.
Thank you so much, Edward. Much appreciated. I see, Jude, you have your hand up. If you can very briefly share what you want, and then I promise we will wind up the call.
Thank you very much. Speaking from breakout room number 7, I'm Jude, co-founder of MCLD, Liberia, and I'm reporting from room number 7. According to our discussion, because we have a length of discussion, and I know that every one of us is speaking in inclusion. I've already perused what we have discussed, but I also had to give a brief highlight of our discussion in our room number 7, which happened to be the inclusion of disabled people in decision making in government level, and not only being in government level, because the disabled people have been vulnerable for time being. And I think according to our group, we are talking about advocating for this group to be able to have them in participating in programming, in skill training program, and participating in government and the national government level to implement in decision making. So we have all saying the same thing, but the most important thing is implementation of it, because government will say something, but they will not be able to implement it. So we are looking at the MCLD to be a power drive to read to government and persuade them to implement the inclusion of the disabled people in all areas of their sectors to be effectively perform their responsibility and be self-reliant in their own well-being. So we all saying the same thing. Thank you very much.
Thank you so much, Jude. And a very, very big thank you for everybody here. We've gone over for 14 minutes. You've all stayed. And I think that shows how committed all of us are to actually translating this intention for inclusion into practice. So thank you for joining us. Thank you for sharing your ideas. Thank you for putting your commitments onto the mural. We will be sharing all of this back with everybody who was on the call and the wider MCLD group. This is not a one-time conversation, as John said. This is an ongoing journey. Inclusion, I love this quote, which I read in an article from a disability rights group on disability culture, which said that inclusion and access are not a destination, they are a journey and a constant negotiation, something that we have to intentionally do every time, every moment of our day and every day of the week and the year as we go about our work. Thank you for joining us on this journey. Hold us accountable, support us in making our work more inclusive. And thank you for being here. We can all unmute and in MCLD style say bye to each other and hear our voices.
Bye.
Bye.
Bye-bye.
Bye, everyone.
Bye.
Thank you so much.
Bye-bye. Thank you. Thank you so much.
Bye from Sierra Leone.
Bye.
Bye for now. God bless you all.
Bye.
Bye.
Remember, leave no one behind.
Bye.
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 A big
Bye.
thank you
Leave
to
no
all
one
our
behind.
interpreters.
Leave no one behind.
Bye.
Thank
Remember,
you,
leave no one
Edward. Thank
behind.
you, Sylvia. Thank you,
Thank you,
Paul.
Gunjan.
Thank you,
Thank you,
Brother
Sylvia.
Ann. Thank you,
Joy,
Gwyneth.
John.
Thank you, Mr. John. Thank you, Mr. Pastor.
Yeah, thank you, Jude.
Well, thank you. Thank
Thank
you very
you,
much.
Jude.
I did.
Bye-bye.
Bye-bye.
Thank you.
God bless
Bye.
you all. Yeah.
Thank
See
you.
you soon.
Thank you.
Bye.